Dr. Angelique Coetzee is an advisor to the board of the Solidarity Doctors Network. She's also a former chairperson of the South African Medical Association. She joins us from Pretoria. Angelique, always good to have you on. If you don't mind, I mean, we could talk about many dormant diseases that are making a comeback. Just polio and measles, if you don't mind. Can people become reinfected, or can they pick up those diseases if they've been inoculated?
Good morning. If you have asked me this question a few years ago, I would have said no. You are vaccinated, your antibody status levels should be fine, and you should not get reinfected. However, that's not what we are seeing currently. We have seen that people being vaccinated with, let's use measles as an example, can still get reinfected. That might be due to two reasons. One, that the measles vaccine, that the cold chain was not kept, and that you actually vaccinated someone with already a dead viral vaccine. So, and then you're not sure why that there is a problem in that specific region. So that's one thing, due to the cold chain being broken. But the other thing is, what we're seeing is there are also subvariants coming through. And your vaccine not always effective against all the different variants for measles. And then again, your own immune system might grow as you get older, might be weaker, and that also can lead you to get a reinfection. And it is really a problem for us currently. And the same with, if you look at the polio, we were all told that there can't be a recurrence of polio. It's been eradicated. And as we have just seen in the previous showing, that what you have shown, where there is a newer variant again being seen in England. And it's of huge concern to us all, because polio is not a nice disease to get. It's like measles. Measles can kill children. And polio also can, give you a lot of problems as you grow older. Musculoskeletal disease predominantly, where measles, if you get severe measles, you might actually die from severe measles. And it's really a concern to us.
Yeah, okay, so what's the recommendation then? That we should all be revaccinated against these diseases?
I think, first of all, we need to get the children that's not been vaccinated to be vaccinated. Then you need to look at where the outbreaks are. If those children had been vaccinated in those regions where the outbreaks are, please then assume that your vaccine cold chain was not kept, revaccinate them. And to make sure that you have a good program in place in the different communities that go out to the people and take the vaccines to the people, get the children vaccinated. For the older people, I think if you are at risk in those cities that there is polio, I think one need to relook at polio and again, try to see whether it's possible to vaccinate them again, to see whether you can get the immune system being much more active than what it is. And remember, as you grow older, your immune system is less active than when you were 20 and 30 years of age. So yes, your two age groups are your young children, and then your older people and your people with a lot of comorbidities and diseases.
Angelique, just briefly, if you don't mind, what is possibly the main reason behind these resurgences? Is this something to do with our lifestyles?
Definitely lifestyles play a role. Then people doesn't want to vaccinate their children. There's a lot of misconceptions out there regarding childhood vaccinations. And then again, what we are seeing is exactly this, the hosts, the animal-human interactions, people not having their environment properly looked after. And then you get these diseases. You don't look what you do, you don't care, you don't, even your dogs and your animals that needs to be vaccinated, you don't take them for their vaccines. And then you want to know, why do we all get these vaccines? There's a current case of monkeypox where the dog got it from its owners. So please, it is important. It's not only from animals to human, but it can be from human to animals. And once if it's in animals, it might be a huge problem to try to prevent the viruses or the different infections not to mutate and get new subvariants that can come back to humans. And it's difficult then to treat this.
Angelique, thank you so much indeed. Always appreciate your expertise. Angelique Coetzee in South Africa.